Welcome to Startup Health TV. My name is Logan Plaster. I'm the editor-in-chief of Startup Health Magazine. This is a special COVID-19 health innovation update, and I'm joined today by Angela Dayton, the CEO of MedForums. Angela, thank you for joining me.
Thank you for having us on the program.
What we've been doing is talking to entrepreneurs about how the pandemic, how COVID-19 is causing them to rethink, reshape, sometimes pivot their own product. Now, MedForums, I know, is a very interesting product that I think we've called in the past a Yelp for medical education,
Mhm.
really a way to sift through the just thousands and thousands of papers that get published. What is it, daily? It seems
Yeah.
like around the world. And here we are in this moment with the pandemic, when getting good information is more important than ever before. So excited to
Mhm.
talk with you about that. Maybe you could start by just giving us a quick minute or two on what MedForums is, the sort of the base product, and then we can talk about kind of how you're thinking through the pandemic.
Yeah, absolutely. So just like restaurants ask for Yelp reviews in order to gather the reviews and then ultimately secure the social proof so that more customers come. The same concept is within medical education, is that say as a consumer, you want to go to Yelp in order to identify the best restaurant according to the cuisine that you want to consume that evening. And MedForums is like Yelp for medical education, basically allowing the physicians and healthcare providers the opportunity to access education that has been peer rated and has peer reviews associated with the education, so that they know that when they go to search for the type of resource that they're looking for, regardless of say the format or the focus, that their peers have actually reviewed that material and that information and have actually validated that it's worth their time, and if they have to purchase it, their money. So when COVID-19 took place here in America, we have actually been kind of on top of it prior to the US actually making their, stance on the COVID situation. So we've kind of been following it across the world, because in medical education, the US medical education industry actually produces the majority of education across the world. And so there are physicians and advanced practice providers and actually residents medical students outside of the US that utilize MedForums to find the best resources. And so we started acknowledging the resources and information that was coming out about COVID-19. As soon as the pandemic hit America, all of a sudden, as we all know, our health systems were overran with the symptoms and the patients. And we heard actually from our users, which are the physicians, the concern regarding the lack of validity of the content being produced, or the lack of content that was being produced and provided for the physicians. So they were getting information from their hospitals, they were getting information from their employers, they were getting information from the CDC, they were getting information from the World Health Organization. But a lot of that information was all patient focused, which, as we know, there's a lot more patients than there are clinicians. And so they were now trying to sift through all of this information regarding COVID and not knowing really what valid information existed. And so we were actually the first ones on the market to aggregate the medical education resources associated with COVID-19 that were healthcare provider focused. So on our site, we don't have patient, content. Of course, patients can consume it, but it's really focused on healthcare providers and the clinicians' access to quality peer-reviewed education. And so we instantly added a COVID tag to our site as part of focus. And then, of course, kind of scoured the internet and, of course, our user base to find out what resources they were actually utilizing and why, and adding those to our site. And so actually, just during that process, we were able to gather very valid clinician-focused education and information that they could then utilize within their patient care as COVID patients came into the hospital.
What has been the response from your physician community to the tool itself?
Yeah, so the response, I mean, the physician community, they love MedForums from a standpoint that it saves them time in identifying the right education to access, and then ultimately, the very creative solutions to apply in their practice. And so, from a response perspective, not only did our physician community kind of take hold and access the education that we had listed on the site, but the education content producers actually started uploading their resources as well once they got word that we were aggregating the resources that they were creating.
Got it. Got it. Now, to sort of push the Yelp metaphor, if we were talking about restaurants, we might talk about sort of small restaurants that got surprise top ratings, and sometimes with these kind of filters, you discover things that you wouldn't have seen otherwise. And I wonder if you have any thoughts about sources of information that turned out to be um, better than expected, or kind of bubbled to the top, and they wouldn't have gotten seen otherwise.
So yes, absolutely. One of our, I would say, actually early adopters of MedForums is Salim, and he's an ER physician, and he manages Rebel EM. And so he actually instantly started gathering evidence-based information regarding COVID-19, and of course was posting that on his blog. And then because he has a presence on MedForums with the positive reviews, actually started getting increased exposure for his content. Companies like DKB Med, which produces a lot of medical education for different specialties like oncology or endocrinology. And in this case, of course, this is going to be an infectious disease. And so they actually kind of went outside of their typical education production and created webinars and information regarding COVID-19 that, again, because of our user base and because of the physicians who come to our site to find those peer-rated and reviewed resources, we're now actually able to access a totally new information content producer and to utilize the reviews to say, okay, yeah, this is something that I want to be aware of. And I think it's important to note that, there are a lot of, say, within the CDC or the World Health Organization, they do have pages for the healthcare providers to access, but it's important for the physicians to be able to talk with one another and to really sift through that information and have their voices heard on what information is actually the most valuable to them. So, some of the things that we saw come through our physician user base was the very creative solutions when it came to the lack of ventilation systems and respiratory systems that existed. And so physicians were coming up with those very creative ways in order to provide that type of, and to fulfill that need within the hospitals. And so once they came up with a solution, of course, they would post about it, and then folks would then try it out and, give ratings and reviews according to that. So, our goal at MedForums is really to aggregate medical education across the board. And because we are very agile, we can really focus that education on what the needs are of our users at that time. And so we did, of course, implement that during the COVID situation. And then I can actually talk a little bit about a pivot too that's taking place, if that is something that's interesting. Yeah. So via COVID-19, again, with MedForums, we started off as a medical education aggregator. But what we found, because of the COVID-19 situation, typically in a recession like this, healthcare is recession proof. But in this particular case, it actually hasn't been. So COVID has really affected every industry, including healthcare. And so, about 59% of our audience are emergency medicine physicians and APPs. And so what ended up actually happening is, because the volumes of the hospitals were down, then the emergency medicine, even though people think like, okay, the emergency medicine and the emergency departments were overwhelmed, in most cases they actually weren't. And so in our industry, we have become aware, again, because of our physician and our communication within our users, that a lot of the emergency medicine board certified physicians are actually being furloughed. And so one of our, kind of new pivots actually coming into, say, Q3 of 2020 is going to be a job board. in order to basically get our physicians and our clinicians and our APPs into positions where there is a demand and into the positions that exist for them. But even more importantly, because of the review platform that we have and the technology within MedForums, is allowing the physicians to actually rate and review job placement and and staffing firms and recruiters, because there's a lot of them out there, and some have good experiences, some have bad, but it's going to be an opportunity for not only in the case where we're working in education and improving education, now we're actually going to be able to improve employment as well as placement of physicians. So we're excited for that kind of, I wouldn't say it's a pivot, but it's an addition to MedForums.
Okay, you're keeping the MedForums product active.
Yes. Oh, absolutely. And again, MedForums, again, we focused on education when we first launched. We're about 18 months old now. So we're going to be going into employment as kind of just an addition to our business model.
And what's the rollout timeline for that?
Yep, absolutely. So with any type of business or addition, of course, you do customer interviews. So we're in the process of actually talking with the recruiting firms and, of course, signing them on, and first and foremost, understanding their issues and their concerns. And of course, we're talking with our users and our physicians and having those problem interviews, because our goal at MedForums is truly to solve a problem that exists with the physicians and that also exists for those who serve the physicians. So by Q3, we will have that as part of the MedForums platform.
Well, this is certainly a fascinating time for emergency medicine recruitment. As you know, there's some rumblings of some closures of contract management groups. There's some real shakeups happening. So I can really see that being a really valuable add-on to your product. What I was going to ask earlier was, it feels like the MedForums product offers kind of a counter voice to the chaos that I've seen on Twitter. There's a lot of physicians, a lot of consumers who go to Twitter they have during the pandemic to get scientific information. And Twitter is, it begins to be utilized as a tool like what you're describing, because people like it and you think, okay, because they liked it, it's valid, but not knowing who liked it or who responded to it. So things are getting voted up, but not with the kind of community responsibility that you're describing. So I wonder if you think of MedForums as being kind of an antidote to some of that social media proliferation of medical research.
Absolutely. Because again, looking, at, say, with the Twitter and the conversations that are taking place, the real value of MedForums is our MedForums review technology, with the star ratings, with the opportunity for physicians to leave reviews about the content and really the validity of the content, how the content is perceived, and ultimately how the content is received and implemented in their practice. And so, yes, is there a lot of, say, communication and conversation happening outside forums? Absolutely. I mean, that's kind of what social media does. But what MedForums does is we basically are consolidating all of that information, all of those ratings and reviews, to be connected to a very specific resource or a very specific scientific evidence-based solution that might exist. Whereas in the universe out there, it can be very convoluted or very separated, where we really do aggregate all of those reviews and the ratings, and even more importantly, the resources that are applicable and usable by our physicians, so that they can ultimately provide the best patient care.
That's awesome. Okay. Well, that's the time that we have. Angela, love to hear how MedForums is sort of bringing the chaos of all of the medical education in the world into a unified place, and getting that physician feedback. So important. And this new pivot, we will be really watching to see how that develops as you begin to bring recruitment resources to physicians. So thanks for the work that you're doing, and I hope you'll keep it up.
Absolutely. Again, our goal is really to ease the jobs and the requirements placed upon our clinicians and our physicians and advanced practice providers. And within MedForums, we actually start all the way in pre-med. So we have resources for the MCAT, we have resources for the USMLE. So really, anyone that's actually in pre-med could utilize MedForums to really start identifying the resources that are most applicable to them. And our goal really is to save time and reduce the stress associated with accessing education and ultimately maintaining the credentials necessary to provide the patient care that we all expect.
Awesome. All right. Well, keep up the great work and stay healthy.
Thank you. You as well.